Welcome back to Good Day State Line. We are in Janesville today at Drier Family Dental with Dr. Drier and Cara. Thanks so much for having us.
Yeah, thank you.
So I know that we're going to be here a couple times learning a lot from you guys, which is really cool. Today we're talking about sleep apnea and oral appliance therapy. So why don't we just start with what is sleep apnea?
Yeah, absolutely. So sleep apnea is a dangerous, potentially fatal sleep disorder where your body continually stops and starts breathing throughout the course of the night. And it can be from a few times per hour to 20, 30, 50, 80 times per hour where your body is stopping breathing and starting breathing again.
So how do you know that you have sleep apnea?
Yeah, so a lot of the big things are clenching and grinding of your teeth, waking up with headaches, feeling fatigued throughout the course of the day, depression, anxiety, weight gain, high cholesterol, diabetes, and that sounds like a lot of things, but it all can be connected. And the way that you sleep at night is pivotal for all those things.
So I actually didn't know that you could go to a dentist if you have sleep apnea. I would have thought you go to another medical professional, but I feel like since we're talking about it, you're probably going to be able to help people.
Yeah, absolutely. So there's a lot of things in the oral cavity that we can find that lead us to think, oh, maybe there's something going on throughout the course of the night when people are sleeping. And that's why we're here to help educate our patients and help them to get treatment if they need it.
So I know, Cara, this is where you come in. Yeah. So what's the first step in pursuing treatment when you have sleep apnea?
Yeah, so the first step would be to be taking a sleep study. So you can go to a sleep clinic and do an in-lab overnight sleep study. But what we do is we offer a home sleep study. So it's going to be done in the comfort of your own home over one night. You come back the following day and we go over the results with you and then decide from there what the best treatment option for you is. So obviously we treat here in our office with an oral appliance, where if a patient is severe, we're gonna recommend them to pursue CPAP therapy.
I feel like it's probably a little more comfortable to do this at home rather than to do it in a lab.
Yeah, yeah, for sure. That's what we found. A lot of people come to us because they couldn't even stay the night.
Yeah.
So.
And don't you have to bring your family members or something and you stay in a lab or something like
bring
that?
Family members, and that's part of it, right? Yeah. So, everybody thinks okay, it's hard enough to fall asleep sometimes, and then to be in a strange room with doctors looking over you and hooked up to all these things, it can be
beeping
difficult
in the background.
Yeah, it can be difficult to get a really good night's sleep and get a good data set from that night.
So when we're talking about oral appliances, what exactly are we talking about?
Yeah, so the oral appliance is going to be custom fit to each patient. So it's not only going to treat your sleep apnea, but it's going to treat your clenching and grinding and protect your teeth that way, as well as snoring. And so what we do is we fabricate that with our digital scanner. So we take a series of images and then we send that off to the lab versus traditional impressions.
Okay, so you actually have one of these in front of us.
Yeah, we sure do. So this is an example of an oral appliance. The overall gist of these appliances is to bring the lower jaw forward. Okay, so when we fall asleep at night, you lay back, your jaw goes back, your tongue goes back, all the muscles in your throat relax, and that can stop your airway from being open so you can't breathe at night. So an oral appliance, and it's hard to see on the model here, but what it's doing is it's bringing that lower jaw forward. And by bringing the jaw forward, it brings the tongue forward as well, which keeps your airway open better at night so you're able to sleep more properly and have oxygen flow, throughout the course of the night.
So if someone was to need this, how quickly could they go from coming to see you guys to actually having that in their home with them?
Yeah, absolutely. So like Cara alluded to earlier, the sleep test is our starting point. That's a one-night deal. Bring it back the next day. We get that data set graded or scored by an actual sleep physician. And then we can get the patient scanned and we get the appliance back typically within 2 to 4 weeks.
That's pretty quick.
Yeah, it is quick. Yeah, it works out very well for patients.
And it does also depend on insurance as well, which is always something that we can look into for the patient.
Okay, so if anyone has any questions for you guys, how can we get in touch with you?
You can find us online at Janesville Family Dentists. You can search Drier Family Dental, Southern Wisconsin Sleep Solutions as well as kind of our business as far as just doing our oral appliances. And yeah, you can find us online.
Coming up next on Good Day State Line, we'll introduce you to Madeline and her grandpa. They're going to talk to us about going over the edge, and then it's Throwback Thursday. Don't go anywhere.